Assalamu alaikum, namaste, sat sri akal and good day. You are listening to Awaz Community Radio. Today we have a GP in the studio and we'll be talking about health and an event that's coming up which I think will be very relevant to Muslims in the local area who are planning to fast and would like some questions answered all about their health. So if you'd like to get in touch with us, you can catch us on Facebook. Just type in Awaz Community Radio. We're on Twitter. All you've got to do is tweet Awaz Radio 122 or give us a call 839 7857. Log on to our website awazcommunityradio.com. Email us awazradio@hotmail.com. Thank you for listening to Awaz Community Radio. Your host for today is Saira. And as I said, we have a local GP in the studio, Dr. Ifat Hussain. Thank you for coming in, Dr. Hussain.
Thank you, Sarah, for inviting me.
You're very welcome. So Dr. Hussain is the public health lead working with North Manchester CTG. And so I think our listeners will agree that what you'll be saying today is something that we definitely take on board because you are, as we say, the expert. So could you tell us a lot more about this event that's happening this Saturday, which I believe is about managing diabetes safely in Ramadan, and it's a family health event too?
Yeah, that's right, Sarah. Basically, it was really quite important to the local NHS in North Manchester, and also realising that it's quite important for the community to raise awareness about fasting safely in Ramadan, in particular for people who are diabetic. It's an event that's going to be held on the 14th of June, which is this Saturday, from 11 o'clock to 3 p.m. At Khizra Mosque. But it's part of a series of events that will be held as part of the Welcoming Healthier Ramadan campaign, which is going to be held in local mosques.
That's great. So the reasons behind it, as you said, are to do with telling people how better to manage the diabetes during fasting?
Yeah, that's right. Just to elaborate on that, diabetes is type 2 diabetes in particular is becoming increasingly common, especially in the South Asian and African Caribbean communities, who many of them who are Muslims also, and will be fasting this Ramadan, which is just around the corner. So the reasons for setting up this event in particular is to try and bring clinicians together who are experts in this field, and also imams who work in the NHS, so health chaplains who can give people appropriate advice about how you can fast safely during Ramadan and being diabetic. We are in particular quite keen to promote this message this year, because we realise that often people with diabetes have a real willingness to fast, but at times it's not always safe to fast for them, but we realise that perhaps they require more appropriate advice, and require a combined advice, so that they're getting the same advice from the clinicians and also getting advice from the imams to support them to fast, because we realise it's so important for them. It's one of the compulsory tenets of the Islamic faith.
I feel this event is a really good idea because, and I'm sure a lot of listeners will relate to this, perhaps especially the younger generation, as I like to think I am too. With the older generation seem to find it difficult not to fast when they have health conditions. So this event is going to help explain when you can and when you can't, and it's combining the religious with the medical, isn't it?
That's right. So that's exactly right. And it's also trying to access people who want to fast this year through the community. So rather than in a traditional GP surgery setting, which is also important, but ultimately that's where the recorded advice is given. But we also want to try and access people in the community, so in their faith centres, so in the mosques in particular, for this campaign. And the reason for targeting in particular people who have diabetes and who want to fast safely during Ramadan is because we know that the fasts are getting longer, with increasing, obviously with it being in the summer months this year and for the next few years, in fact. So a fast can last up to 20 hours. So this puts them at certain risks of fasting, especially if perhaps it's not always safe for them to fast.
So what kind of risks are associated with very long fasts, Dr. Hussain?
Well, in particular, for people who are diabetic, they're at higher risk of becoming more dehydrated. Also, they're at higher risk of developing something called hypoglycemia. This is where the blood sugar levels drop to really quite low level, which can be quite dangerous for them, and at times, potentially life-threatening if not dealt with very quickly. The other risk that that they potentially could be faced with is having hyperglycemia. So these are very high blood sugar levels because obviously they perhaps maybe haven't adjusted their medication or their insulin at the right time, and this can also make people really quite unwell.
Dr. Hussain, could you explain to our listeners what diabetes is? Why is it important for this message to be spread?
Well, diabetes is a common condition. It's a condition where the body isn't able to handle sugar very well. So this is usually as a result of something called insulin, which is a hormone that helps us to lower our blood sugar after we've had a meal. So this is when the insulin that's being produced naturally, which when you have a meal, it helps us to lower our blood sugar levels. In people who have diabetes, the insulin that is being produced is either not enough, so they're not producing enough of it, or the insulin that is there is not working very well. So what that means is they end up with higher than average blood sugar levels going around the body. And this can give symptoms such as feeling quite thirsty, feeling really quite tired, going to the toilet a lot, to pass a lot of urine, having blurred vision, sometimes being irritable, and sometimes getting lots of infections in the private area such as thrush. And these are all signs of having diabetes and having really high blood sugar levels.
So what are the different types of diabetes? How common is diabetes?
Well, diabetes is extremely common. I think up at the moment in the UK, somewhere between 3 million to 4 million people have diabetes. And in fact, somebody gets diagnosed with diabetes every 5 minutes. So it's extremely common. And in fact, in individuals of South Asian, African, Caribbean communities, compared to the Caucasian population, so the average sort of white counterparts, it is more common. So in South Asian, people of South Asian origin, is 6 times more likely, and in African Caribbean communities, they're 4 times more likely to develop diabetes. So it's really quite important condition to know about, to be aware of, and also knowing how to manage that diabetes during festivals such as Ramadan. But there are other festivals throughout the year where it's important to be able to manage the challenges such as these.
So what kind of advice and tips would you offer to those fasting in Ramadan?
That's a very good question. It's important that people who are fasting who plan to fast this year, and in particular have diabetes, but any other health condition, in fact, it's really important that they make time to go and see their GP or their nurse in the practice, or the specialist nurse, whoever really they see most for their health, to get that pre-Ramadan check done, because it is possible to adjust your medication so that you can fast safely. In particular, if you're diet controlled diabetic, or in particular if you're a diabetic who is taking tablets with insulin, is perhaps not, it is possible for it to be adjusted also, but it's really a conversation that they need to have with their clinician, because there is clinical guidelines out there that have been produced to guide clinicians to help people fast safely during Ramadan.
I get the impression that this event will be a really good opportunity to say to people it's okay to talk about the option of not fasting. It's not a choice that necessarily is your own, but if your health does not permit it, I think it's great, this event. It's going to give people a chance to. It's perhaps a bit of a taboo subject, I think, for some people. It's a case of, no, I have to fast. I've always fasted and I have to, and it's just something I can't stop doing, and I can't. Some people, I think, don't feel, especially the older generation, perhaps feel that they can't talk about the idea of not fasting because that is a reflection on them perhaps not being as religious as the next person.
Yes, that's quite true. I completely agree with that. And in fact, there's research that has been done by independent researchers that, in particular, show that British Muslims don't feel supported always by the healthcare. And this is, and I think that's perhaps a misunderstanding on the clinician side as well. That they perhaps want to support their patients, but they want to. They're very careful about the importance of their religious obligation as well. So I think there is a genuine desire for clinicians to help support patients through fasting, and this event will hopefully provide that opportunity. But ultimately, it is important that this event is not. Whilst we will be giving general advice to people, it's still really important that they do go to their GP to have that conversation, because sometimes it is safe to fast, but there are people who perhaps, especially if they've had a low blood sugar, hypoglycemia event in the last couple of months, or they're on certain medication, or they have other medical conditions, it really would not be safe to fast. And in that situation, the clinicians would be advising that having had this conversation now, that these are the reasons why we don't think it would be safe for you to fast, and that hopefully people will understand that and take that on board, because as you say, there are exemptions in Ramadan for people, and if it's really important that you take care of your health, because if you're not able to, if you take that risk, that potentially could make you feel quite unwell, and it may mean that you're not able to fast the next year, or it really increases the risk of complications.
So it really is a case of it would be helpful if, like you said, that clinicians having that kind of cultural sensitivity, because telling someone who has perhaps fasted, especially I would say perhaps men as well, who don't take the time off as women would due to expecting children and feeding and so on. So men especially, I wonder, who have not had that break at all from fasting, being told not to fast by someone who they feel doesn't understand where they're coming from, that can be difficult.
Absolutely, and this is something that we've been quite keen to promote with the local clinicians in the North Manchester area, to try and promote that understanding, so they really understand the patient's perspective. But ultimately, we are all here to serve them and to support them through their choices. So we'd like people to come and have that chat, and these events by accessing people through the community, which we feel really works, because as you say, there are people who can't make that time out to come to see their clinician. Obviously it's important, but hopefully this will be the trigger to them to then go and have that conversation. But yeah, men in particular, and especially working people. So the event is held on the weekend to make it easy for them to come and at least get some basic information about some tips, such as eating healthy, having those eating complex carbohydrates such as oats, semolina, dal at the Sahar time, so the pre-dawn meal, so that they are able to go through the day a bit better, rather than having things like fried foods or things that are really quite high in sugar and quite high in fat, which perhaps, although they're tasty, they're perhaps not the sort of food that will help you get through the fast and such a long fast. And that advice really goes for everybody, not just people who are diabetic.
I believe there'll be health checks on the day.
Yes, that's right, Sarah. That the community stop health bus, which is a health bus that goes all over Manchester. In fact, will be providing checks such as cholesterol, sugar checks, diabetes tests, checking your height, your weight, and a really good check that wouldn't last more than 10-15 minutes. It's absolutely free, and it'll be available to everybody on the day who are at age between 40 and 74 years old. That's just part of the NHS health check. That's just the age that's defined by them.
I was wondering, so if you fall out with that age category, health check wise, so what can people do to get themselves checked out?
Coming to the event it would be quite important, because there'll be lots of health stalls available on the day, not just about diabetes, but about getting help with smoking if that's a particular issue that you want to tackle this Ramadan or through the year. In fact, there'll be other health events about your heart, there'll be activities for children and smoothies. So it is really a family health event, because we realize that, for example, diabetes and Ramadan in particular, it's not just an important issue for the patient who's actually going through this. It's actually important for the whole family, so that they can understand from their perspective what changes they need to be made. But often, as I said earlier, those changes that the patient needs to make, or the person who's fasting, those changes would apply to everybody. So I think doing something together is always quite good. So this will be something for everybody.
That sounds really good to me. I think making it child friendly, making it family friendly, to me sounds like an even better idea. It's not just about the individual, it's about families and setting good examples for the future generations, teaching them as well.
Yeah, that's right. And I'm really glad that you support that, and I think that it's about understanding the community and their needs, which hopefully this campaign will do. But in particular, just wanted to go back, is people who are South Asian, they are 6 times more likely to develop diabetes from an earlier age. In fact, as young as 25. As you say, the health check at the moment don't cover that age, so it's really quite important to come and get that, come and get some information. And I'd really be encouraging people, especially if they have got a strong family history of diabetes, which often can be the case in these communities, that they have a chat with their nurse at the practice to get a simple blood test done for diabetes, because if it is something that is picked up at an earlier stage, it helps you manage it better, and it helps then reduce the longer term complications that can be associated with diabetes.
Thank you for that, Dr. Hussain. So, shall we just remind our listeners of the details about this event?
Yes, so the event this Saturday is between 11 a.m. to 3 p.m. at Khizra Mosque, which is on Cheetham Hill Road. It's the talks that will be delivered by specialists in diabetes and imams, will be accompanied by the Lord Mayor and Afzal Khan MEP. Will start at 12:30. And will last approximately an hour, but there'll be a free fruit and date goodie bag for everybody who attends the date.
Well, I think that's a great incentive. That's a great incentive for people to go, really.
Well, yes, it's a healthy snack, hopefully, and we'll be getting the rewards of everybody who fasts as well by them taking their dates. So,
of course.
If anybody does require any more information, you can contact Al Halal Community Project, which is 0161 205 663, or the mobile number is 07736 525 958.
That's great. So if someone isn't able to attend, Dr. Hussain, this Saturday, are there other events going on that can help people learn how to manage their health better during Ramadan?
Yes, as this is part of a healthier Ramadan campaign, and we're working with local mosques, there will be another event that will be held at North Manchester Jamia Mosque on the 20th of June after the Friday prayer, so approximately after 1 o'clock. There will be health stalls available on the day, and also health checks for everybody of any age on that day. And there will be the bus that will be coming. The NHS Health Check bus will be available in the local area near Al Falah Mosque, and also the Gurdwara and the church in that area on Sunday 15th of June. So if you didn't get a chance to have your health check on the Saturday and you wanted to, you'd be very welcome to join the bus on the Sunday.
So there's no excuse, really, for those that are lazy or off to the park if we are blessed with sunshine in Manchester. Then it's happening both days then. Yeah,
that's right. I think that's entirely true, that everybody, we're giving people plenty of opportunity to really put their health first, and as well as promoting focusing on their spiritual side in preparation for Ramadan, getting their health and their body ready to go through the challenging long fast that everybody's going to have to go through this year.
I'd like to say a really big thank you to Dr. Hussain for coming in and talking to us about this event that's going on. Well, there's 2 events going on this weekend about how to manage your health better in Ramadan. It's a family health event. It's about trying to manage your diabetes more safely. Thank you so much, Dr. Hussain.
Thank you very much, Saira, for inviting me. It's been a real pleasure to be here.
Wishing you guys all the best. I hope you get a really big turnout, and I hope people from the community really take a lot away from it as well. Not just the goodie bags, but information, and just information for life really, and information for their own health.
Yeah, that's great. Thank you very much.
You've been listening to Awaz Community Radio. Your host is Saira. Thank you for listening.